hand over to Will. Will is CEO of Heart Valve Voice, the charity dedicated to raising awareness of heart valve disease in the UK, but also more internationally. Thank you, Will.
Thank you very much, everyone. It's an absolute pleasure to see so many people joining on Facebook Live and here in the webinar room. Thanks, Simon. Yes, I'm Will Wone, Chief Executive of Heart Valve Voice. We are a charity specifically here to raise awareness of the disease of heart valve disease and make sure patients get the right treatments at the right time. I'm absolutely pleased as punch to see the panelists here all logged on, and I'll go straight to introduce Chris Young, who can then introduce the rest of the panel. Chris is our chairman, cardiac surgeon from St Thomas's, and he really has been a fantastic steward for the charity for the past couple of years. We're a young charity, we're only 5 years old, but Chris, under his leadership, has made the charity fantastic efforts right across the disease sector. So Chris, can you introduce the rest of the panel?
Yes, thank you very much indeed. And as you can see, I'm sitting here in St Thomas's Hospital waiting to do a clinic later in the day, and how nice it is to be able to see patients with heart valve disease face to face again after all that we've been through. But also with us on the medical side is Professor Huan Gray, which from a cardiac, from our perspective, is a sort of household name and highly respected. Recently retired director of the National Clinical Director for Heart Valve Disease, and very heavily involved in the management of cardiac patients throughout COVID and the past 6 or 7 months that we've been through. And then also on the panel, I'm absolutely thrilled to introduce Roger Black. I mean, he's a man that needs no introduction. I think Atlanta 1996 changed his life, certainly made him known to the whole of the world and greatly respected. And he's been here at St Thomas's on and off. I've seen you around with television programs and so on ever since. I'm thrilled that you're participating and giving us your point of view, Roger. I've been asked to explain what is heart valve disease and how do you put that in a sentence. I'm going to say that the heart is an engine. Everybody knows when your spark plugs aren't working, because everyone knows someone who's got a pacemaker. Everyone knows when the petrol isn't getting there, because if you don't get the fuel, the heart doesn't work. That leads to heart attacks. You need your pipes cleaning out with stents and balloons, or you need bypass surgery. And everyone knows someone who's had heart attacks, bypass surgery, etc. But right in the middle of this engine are two valves, the inlet valve, the outlet valve. And that's what this day is all about. And those valves can either fur up and block and stop blood going forwards and through into the heart or out of the heart, or they can leak, which means that the circulation becomes very inefficient. The blood goes forward and then it goes back through the valve and forward again, and you've got 2 steps forward, 1 step back circulation. And what's even worse is that you can then put the two together, and some valves are tight and they also leak. So today is all about raising the awareness of this type of disease, which presents very benignly often. I'm feeling my age. I can't get up that hill the way I used to. Or it presents very spectacularly in the back of an ambulance when people collapse, they get breathless in the middle of the night, they fall down unconscious. And we want to raise the whole profile of this so that everybody is more aware of it, and the treatment starts earlier rather than later with the spectacular and the blue light. So Huan, I'd just like to start with you. We've been through a lot over the last 6 months, and everyone's read in the paper about how cancer diagnosis and treatment has fallen behind. Clearly, there's been a big impact on the management of heart valve disease. Can you just give us an insight into what's been going on and how we've all managed to try and cope with what's been a very difficult situation?
Well, thanks very much, Chris, and thanks very much for the introduction, and good morning, everybody. Yes, if you're referring specifically to COVID, of course, it's been a very, very difficult time, and not least because face-to-face consultations, as you've already alluded to, haven't been taking place, and that's so important for the purpose of diagnosing valve disease. As you've already pointed out, the awareness of valve disease, certainly amongst the general public, and I'm sad to say to some extent in the medical profession, has not been what it should be. And as again, you've already alluded to, often the symptoms of valve disease are attributed to something else. So breathlessness being one of the most common symptoms, often put down to lung disease or put down to someone just getting older or perhaps having put on weight. And so valve disease can progress for quite a long time, with it often being unrecognized. And that's certainly borne out by the statistics, which show relatively low detection rates. We know that there are a lot of patients out there who have undetected valve disease. And this is perhaps particularly so of the ethnic minorities and those for whom English is not their first language, because their access to health services is not as good. Finally, I think one of the challenges has been that, industry has produced a huge amount of innovation, as those of us in the profession know very well, but it's often been a little bit slow getting to patients, and that's something that clearly is one of the things we need to address.
During the pandemic, we did over 1,000 heart operations in London. And that only happened because of coordination between centres and people like you bringing everyone together. And actually a lot of those, probably the majority of the operations, were for people with heart valve disease. Could you give us all some insight as to how that ran and how it was such a success, despite the problems that we had with the infection all around? And if you caught COVID after heart surgery, that was bad news.
Yes, absolutely, Chris. And my comments are really confined to London, because that's where I've had recent experience. But during the surge phase of the pandemic, as you know very well, all emergency cardiac surgery was undertaken in two hospitals in London, which managed to maintain high levels of activity. One of the other things that was recognised early on is that because of the risk of COVID, and particularly the risk if you acquire COVID and you undergo heart surgery, the outcomes, as you know very well, are very poor. And so there was a slight shift to perhaps less invasive treatments for valve disease. I'm thinking particularly of transcatheter aortic valve implantation as opposed to cardiac surgery. So we have seen an increase in TAVI procedures undertaken. I'm glad to say that in recent last couple of months, elective activity has returned to all of the cardiac surgical centres again, as you know. So I'm sure conventional cardiac surgery for elective cases, the numbers are certainly increasing. Having said that, there is a significant waiting list of patients who have been on awaiting treatment and not had it done in the last 6 months, and increasingly because patients are not being diagnosed as early as they should be in as great enough numbers, we sense that the backlog is going to increase for the foreseeable future. So it simply highlights the fact we need to be very aware that there are a large number of patients who require investigation and treatment who have not had it as quickly as they would have done before the COVID crisis.
Thanks. And Roger, looking at it, or you've heard from the professional end of it, dealing with it. Can I ask you about your side of it from the other spectrum? First of all, could you tell us perhaps something about why you're here and what your issues are?
Sure. And it's always slightly strange for me to be in this situation, because I've lived with valve disease all of my life, and touch wood, up until now, it really hasn't affected me. I'm on my, I think, 4th consultant now, Ewan. Ewan was one of my consultants. I started, I was diagnosed when I was 11 years old in Southampton, and Neville Conway was my consultant and saw me through to my sort of Olympic days, and Ewan as well. And it's a strange one for me because I have an incompetent aortic valve. As a child, I would go and see the consultant once a year and have my echoes and whatever, and now I get the MRI scan, and I go still go, and I'm still checked. I'm 54 now, and it's certainly more real for me now. It's something I'm much more aware of. I don't feel any different, but I know I'm older, and therefore I'm much more aware of it. It was strange being an athlete. It was very strange for everybody that I was able to do what I was doing physically, training to try and win Olympic medals and achieving that, but at the same time, once a year sitting in the consultant room at Southampton General, knowing that I may be told I had to stop running. I'm very fortunate that it was diagnosed early. I'm very fortunate that I have been in the hands of people like you, and I'm very fortunate that my heart has been monitored all my life. And as you said earlier, Chris, and Ewan has said that there are people out there who don't know that they have valve disease. So I count myself as very fortunate that the moment when or if the symptoms come, I can pick up the phone and I can be seen straight away. So I feel very fortunate in that respect. So it's a strange one for me because yes, I have chronic heart disease. I'm in that category, but I feel absolutely fine. Yes, I exercise regularly. Of course, I had to as an athlete. But I'm certainly aware of valve disease much more. My mother-in-law had a very successful valve replacement 9 years ago. She's 89 now, and quite simply, it saved and changed her life. She went from hardly being able to walk, and it happened very quickly in her case, to having the operation, and then having a terrible 2 months in recovery, and then literally a new lease of life. So I've seen it firsthand of the devastating effects of having valve disease can have on somebody, but positively I've seen the incredible effect of a successful operation. So I live knowing that I have the condition, but knowing that the world has moved on, and people like yourselves obviously are doing incredible work. So I don't live in fear. I live knowing that when things, or if things go wrong with me, action will happen very quickly, and that gives me a lot of confidence. And the work that people like yourselves and Will in particular are doing with this charity, the awareness for people, I think is really important. So that's why I'm here. I'm not just here as a faith. I'm here as somebody who legitimately has valve disease, which is still very strange for me to say.
When I was training, the medical profession was quite didactic. You would be told, you wouldn't be involved, you'd be told what was wrong with you, and you'd be told what you needed doing and when. Do you feel that you're actually heavily involved in the decision making, in the understanding of what is going on? Or do you still come away sometimes thinking, I wonder what that was about? He told me I didn't need an operation, but I don't know anything.
I think in my case, and I think one of the things that Ewan always said to me, because we always had this discussion when I would go in and sit down, it was always very surreal, because I would sit in the waiting room every year, and people would recognize me, and I'd sit there, and I was perfectly healthy, and I would sit in the same room as people who were quite clearly very, very ill, and they were seeing the same person. And what I understood is that this disease, or heart disease, but certainly valve disease, affects different people in different ways. And I've been very, very fortunate. There's no doubt about that. In my case, certainly as an athlete, I just wanted to go in and be told that I could carry on running. I didn't need anything more than that. That's all I wanted. By the way, I didn't go in 1996, because even if they said no, I wouldn't have stopped. Now I go in, I have an interest, but I have to be honest with you, all I need is to be told that your heart's looking okay, everything seems fine, come back and see us in a year's time. That's enough for me, if I'm honest. But I think I'm very fortunate. I don't, if I was having the symptoms, if I was feeling terrible, then I'd really want to know. I'd really want to know. But I'm very aware that by nature, I live an active life. I exercise regularly. I have an awareness of a healthy diet, and I'm not carrying much excess weight. So, I'm probably doing what I need to be doing. But yeah, I mean, information, I think certain people need a lot of information that gives them peace of mind. I think other people just want to be told you're okay. And I was in the latter camp myself.
Right.
I mean, actually, I have to say one of the reasons for that, I think, is because as an athlete, I didn't want to use it ever as an excuse. There are very few people in my close circle, only a handful, to Chris Akabusi, who trained with me, knew about it. My father was a doctor, he knew about it. My coach knew about it, but it wasn't something I ever publicized as an athlete. There was a reason for that. I didn't want it to be an excuse. And it never was. So I really didn't think about it when I was running. And maybe that's why I don't need too much information, because I thought, put it at the back of my mind. And in my case, I think that's been a good thing.
Well, if you had to pick as an athlete, that's a pretty good choice to have aortic valve that leaks.
Well, yeah.
Of
course. I mean, I don't know, you're the experts, but I remember Neville Conway, just before he retired, he always used to laugh about this. He had this theory that it might have actually helped me. My heart has overcompensated for its inefficiency, because I was actually never more out of breath than the next athlete, and I recovered pretty quickly. So it was illogical on one sense, but maybe you're the experts. Maybe it gave me an advantage. I don't know.
But I don't want to dwell on this, but I have met patients who can't walk very far, but they can run.
Really?
And the issue is that when you run, you compensate.
Okay, that's interesting.
It is. Will, let me bring you in. Do you want to just set the scene? Tell us why today is so important, and what is to come, and where we're going to go.
Yeah, sure. So Heart Valve Disease Awareness Week is actually part of a much bigger project. It's a global campaign involving 13, 14 countries, from as far as Japan to Mexico, Canada, and right across Europe. We sit on the Global Heart Hub's Heart Valve Disease Patient Council, and this is one of the initiatives, one of the many initiatives that we've delivered this year to raise awareness of the disease. As many of you have already said, the awareness of heart valve disease, particularly across Europe, remains stubbornly low. We've just carried out a European study of thousands and thousands and thousands of over 65s, questions around, do you understand what the disease is? What's the common forms of the disease? What are the symptoms? And how do you think this disease is detected? 96% were unable to identify what aortic stenosis was, which is the most common form of the disease. And that tells us there's some significant issues within our community about understanding what the disease is. The vast majority said they don't know what those symptoms are of breathlessness, tiredness, dizziness. They could kind of guess, but they weren't able to connect the two, or even separate the two between the natural signs of aging and these symptoms. What the survey also told us was that we're not actually listening to our hearts, particularly in primary care. Now, we know primary care have adapted absolutely brilliantly during these past months, and what this survey tells us is that we got to encourage older people to use the best out of any kind of face-to-face opportunity. So if they're worried about breathlessness, tiredness in themselves or their family or loved ones, when they are in primary care, we should have our hearts listened to, because we can hear that murmur, the earliest point in which we can detect the disease. So the campaign features around listening to your hearts, and for all the audience there on our social media, the hashtag listen to your heart will enable you to find out what everyone else is doing across the globe. You can follow that. And the third theme is around the power of positive aging. We say that this disease is a common disease, and we say it's a serious disease, but it's a treatable disease. When we say it's common, the Oxfam study says 1.5 million over 65s have heart valve disease. We're an aging society, so we're all getting older. So we're seeing more of the disease. And Oxfam predicts that there'll be 3.3 million by 2056. So it's common. It's serious. We know that if left untreated with severe aortic stenosis, 50% of people will die within probably 2 years. So it's a serious disease, but it is treatable, and it's treatable. And if we detect early, patient outcomes and experiences are much better with this disease. So what we're trying to get through to people is about the fact that it is treatable. You can go on to live a good quality of life. And the power of positive aging tries to recognize and celebrate and cherish the contribution that our older community give to society, whether that's going back to work after treatment, or whether that's volunteering, or supporting a loved one, or caring. There is a huge unseen army of over 65s that care for relatives. So we need to make sure that we increase the awareness of the disease, the symptom recognition, get our hearts listened to, and celebrate and cherish older people. So here in the UK, the activity, we started the week with a media campaign. We had patients right across the UK and clinicians ready to go on the radio, and we went on the radio 17 times, 5 TV appearances with patients in enjoying the quality of life after their treatment, that reached probably just under 10 million people. So we've had a brilliant start to the week. And today is our kind of flagship event, and it's great to see the program that we've been able to develop. We've got 6 hours of education sessions that I hope will inform and involve and inspire people to learn more about the disease. We've got 18 speakers, and that includes GPs, nurses, physiologists, cardiologists, interventional cardiologists, surgeons, cardiac nurses, and I would argue, most importantly, patients. Patients are involved throughout the design of this program, the delivery of the program. So we're very excited about that. The sessions span symptom recognition, what the disease is, detection, treatment, post-treatment, and patient experiences. I think we've got about 180 patients involved, whether that's through the Facebook Live or here in the webinar today. So any questions that people have got, Chris, we'll be collecting, and we've got an advisory panel who will be answering those questions for people, and we'll distribute that through all our normal channels over the coming days. But for those that are following online, we've got a very active social media program. So you can follow on hashtags of HVV 2020, listen to your heart. And on Facebook, we want to see those love emojis and all those kind of smiley faces, and you can always raise your hand throughout these sessions, and Simon will be able to answer any kind of questions. But that's what we've got on today.
Great, thanks, Will. I have to say, one of the biggest challenges, or my biggest worries, is that we've been pushing that patients should have their hearts listened to. Compared with Europe and everywhere else, we have a very low percentage of patients listened to. We're pushing to get it, and now patients cannot see their GPs. And we almost need to find a way of getting around that, because a lot of this is face-to-face. It's the subtle things. It's seeing the patients not doing as well because you've been their GP for years. And I'm worried that this lack of face-to-face contact will set back what we've been trying to achieve. I don't know if you've got any thoughts, Hill, on how screening is the wrong thing, but there is a danger if people are not being seen face-to-face, that this will actually set the whole process back.
Yes, absolutely, Chris. And I think perhaps the most important time is the first presentation. I think when a patient first presents is the time you really do need a face-to-face consultation. Certainly during the COVID peak in London, something like 90% or over 90% of GP consultations were all virtual for understandable reasons. That has decreased a bit to more like 80%. But there's a real question as to, and I'm not a primary care clinician, so I shouldn't be talking authoritatively about this, but I think that there is a real piece of work to be done to determine what proportion of patients being looked after in primary care are perfectly well looked after with virtual consultations, and which patients particularly need face-to-face contact. And I would say that an awful lot, certainly those with suspected valve disease, certainly need face-to-face contact for at least for their first consultation. Subsequent follow-up when patients are known to have valve disease often, of course, includes echocardiography and so forth. So you can get around some of the need for face-to-face, for actually a physical examination. But you do need a physical examination to help make the diagnosis and determine what investigations are undertaken.
Well, I mean, that's one of the things for me that would be the highlight of the day, how the GPs are going to respond to this. And my own feeling is that if anybody is going in for a particular reason, to have a flu jab, to have their blood pressure checked, we almost ought to make it mandatory that when people turn up, if you're above a certain age, you automatically get checked out, because otherwise these people will slip away. So I'm really looking forward to what the GPs will say and what the patients say about their experience about meeting their GPs and whether they feel safe in never being seen. Roger, what about you?
I was thinking what you were saying. I mean, in my case, you know, my leaking heart valve was detected at a school medical. I mean, it literally was, you know, come in, take your top off, listen to you, you know, check everything, and they listened and they heard it. And next thing, I was then sitting with Neville Conway, my consultant, and, you know, clear as can be. I'm just thinking if they hadn't done that, you know, at that moment in time, it wouldn't have been detected. I guess at some point someone would, but I suppose you have to know what you're listening for as well. And in many ways I was lucky, but yeah, sure. If it has to be a face-to-face consultation, doesn't it? I mean, you can't listen to a heart online, can you? So I understand the frustration there. So yeah, maybe if people are concerned, they need to have the confidence to ask. But you know, obviously these are difficult times.
So the session at 10:15, people on Zoom here and live on Facebook will be able to watch that stethoscope check, a live diagnostic of a stethoscope check and echo, so people will be able to see how that detection can happen. So I hope people will find that quite interesting.
Great. Well, I don't want to overrun. It's been thoroughly enjoyable. Lovely to see everyone, meet them, and see both the professional and the patient's perspective. And that, to me, is going to be the important aspect of the day. This isn't just a lecture by doctors. This is patient interaction, people saying what we want, and people trying to become much more aware of what is, a lot of the time, a degenerative process. Everyone knows when you've got a bad hip because you can't walk, you need a stick.
Yeah.
But when you get a bad heart, you need someone to listen to it and tell you before it tells you. And that's the only way forward. So thank you very much to everybody. I'm going to hand you back. And I'll go and see a patient who's got aortic stenosis of all things. I'll join you later.
Let's send them our best.
Great. Okay.
Superb. Thank you. Thanks, everybody.